Hi everyone, Dula Monica here, and today I'm going to talk to you about pain. Pain in labor, one of the most and the biggest concern of most people, especially those that are about to have a first time baby. They don't know what to expect, so it brings on that fear, and so the fear just escalates into anxiety, and everybody worries about the pain. So, before we go into this really cool acronym that one of our doulas, Tammy, found on a nurse's message board, I just want to talk a little bit about that pain and how you can relieve the pain naturally. Of course, natural is best when you are in labor, but that's when you are in normal labor. So that's not to say that if your labor is really extended and really long and you're not dilating typically like you should be, or anything gets in the way, don't ever feel guilty about asking for some pain relief or some medication. But with those pain relievers and analgesics and epidurals, every time you add something into the mix of labor, you're looking at a possible side effect. And also, when you go into an epidural, if the epidural doesn't work and you don't have anything else to fall back on by using comfort measures, then you're in a bit of a state of panic because you are counting on that. So that's why I say natural is best, and kind of start with natural, and you might surprise yourself as to how well you will do. Some things that really help relieve natural pain are comfort measures such as the shower, laboring on the ball, and also being in a really good state of relaxation and surrendering and letting your body do what it knows how to do. One thing that I say to a lot of our doula clients is if you've ever seen an animal like a dog or a horse or a cat ever in labor, they are never shrieking or screaming out in pain, but yet if you step on their paw, they know pain and they will shriek or bark or whine. So it's not that they don't know pain, but because they don't have the intellect and the intelligence of a human being, they are readily able to surrender to this process that's happening to their body. So they kind of just step back, let it happen, and they give birth. So we need to try to learn how to do that, learn how to just surrender and not think so much during the labor process. Another tool to help you too is if you can think of a triangle, the fear, pain, tension triangle. And whenever pain is escalating, all three of those elements are in play. There's fear, which creates a lot of tension, which makes your pain worse. So if you can eliminate one of those things, so if you can try with the tension by relaxing in the shower, somebody massaging you, somebody just touching you, laying their hand on you, talking to you, supporting you, that relieves tension. It brings down the pain. And when the pain is reduced, then your fear of the situation is reduced. And then this nice circle of just relaxation and surrender happens. So that's one way as well. Using comfort measures, there is also a theory called the gate control theory of pain. And what the theory is in a nutshell is the message way to the brain when you hurt yourself, it's kind of like a highway. And so you hit your finger and your brain says, oh, she hit her finger, ow, 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 sends pain and also sends endorphins to help deal with that pain. So if you can busy up the pain highway, as it were, with other sensations, it's a very narrow pathway and the pain can't really get on the highway. So you're trying to create a bit of a traffic jam with other sensations, which is why if you bang your finger, the first thing you do is start rubbing it, and that's busying up that highway and it reduces the pain. So when you add comfort measures, particularly sitting on the ball in the shower, all those little droplets of water are touching you and they are sensations, and it's busying up that highway and it sends the message to the brain, all these nice wonderful sensations. Your brain washes you with endorphins and this beautiful cycle of relaxation happens and your pain is greatly reduced. That's why laboring in the shower has been also called an aquadural versus an epidural. So now I'm going to talk to you about this acronym for pain, which will help explain the pain in labor. Now, labor pain is totally different than acute pain or chronic pain. Acute pain might be you break your leg and your body's telling you, oh my God, you don't move. We need to deal with this pain and we know what to do. And they will give you drugs for the pain because there's no purpose in this pain other than letting you know that you have injured yourself. So that's why we have pain. Chronic pain is pain when there's no outward injury, but you've left with this chronic pain. So people have to learn to live with that kind of pain and knowing that they won't re-injure themselves. Now, labor pain is a totally different kind of pain. Labor pain deserves respect. And not to say that there's no relief, and like I said, relaxation helps with it, but it is the P for the pain is purposeful pain. This pain has a purpose, it has a reason. And when you know what your body is doing and understand that the pain and the sensation that you are feeling is your body dilating, the cervix thinning out, opening up, and making an opening so that you can meet your baby, that is the purpose of the pain in labor. It's purposeful pain. The A for pain stands for anticipated pain. This is something we've been waiting for 9 months. We wait to go into labor. It's kind of exciting and you're anticipating it, and it sort of adds to that, yay, this is the last step until I meet my baby. The I in pain is for intermittent, meaning the pain does not stay steadily like if you broke your leg. There is a break. Contractions, the strongest ones, last 60 seconds to maybe 80 seconds and no longer, and those are the strongest contractions. And then you'll get a bit of a break, sometimes 10 minutes, 5 minutes, a minute, but there is a break. And it's important that during that break time, that's when you regroup, take a deep breath, and get ready for the next contraction. I find that a lot of people spend most of their time, if they're going to fret, it's during the break, the intermittent part, not during the contraction. During the contraction, they're very focused, just like that dog or cat or horse. They're focused on what they're doing, and then when the contraction is over is when they start, oh, that was so bad, I don't feel great. But if you can try to relax in between, and then know that the pain is intermittent, know there's a purpose, know this is something that you were waiting for, then it will help you cope with the pain much, much better. And the in pain is necessary. We know that this is necessary for first to let us know that we're in labor. If there was no pain in labor and we didn't have any sensation, babies would just be falling out everywhere. We need to know that we need to stop, get in a safe place, feel safe and comfortable and relaxed, and prepare our nest, as it were, for our babies. So it is necessary in pain. And remembering there's a baby at the end of this, and focus on your beautiful baby. Now, there is a big difference between pain and suffering. When somebody is having the kind of pain that I was just talking about, usually they can cope very well. But when that pain crosses over into suffering and it's impacting how that mother is laboring, then it is important to introduce some kind of pain relief for her, whether it be analgesics or an epidural, because sometimes I believe that you have to take the lesser of the two evils. And if your mom is falling off the rails and really not coping. Maybe she was quite sick before she went into labor. Maybe she had a long early phase or prodromal phase of labor that was quite exhausting, and then active labor began and her coping skills are not good. If she's about to give up on the process and a little bit of relief or an epidural or something will help her get some rest, then it's the lesser of the two evils, because we don't want her to give up and can't push at all, and then she ends up having to have a C-section. So that is my explanation of pain in labor. So if you have any comments or any questions, feel free to leave them in the comments section below. And please subscribe. And thank you for watching.